presentation, which is the gigantic realm of cancer nanomedicine. So yeah, so good evening, everyone. So I will be introducing about cancer nanomedicine. So here's an outline of what my presentation will be. So I will introduce first about myself, and we will look into cancer. Yeah, because cancer nanomedicine is, of course, about fighting cancer. So we will look at cancer first, and then I will be introducing what is cancer nanomedicine and why the size matters or why it matters. And then I will be introducing some cancer nanomedicine in action and also what the future will be on cancer nanomedicine. Hey, so I think Deej made a quite overwhelming introduction about me, but yeah, I am a second year PhD student from Tokyo Institute of Technology and I'm majoring in material science and engineering. And yeah, actually I'm not so good in introducing myself, so please bear with me a little. So yeah, so my research is about specializing in biomaterials and in advanced inorganic materials. So specifically, I work on cancer nanomedicine, so developing materials for the treatment of cancer. And I am from the Philippines. So I arrived in Japan during the time of the pandemic, 2020. So I've been living in Japan for more than 3 years. And this is actually a photo of my first day in Tokyo. So I arrived in Shibuya Station and I took a picture of Hachiko. And yeah, you can see here that people are wearing masks and there are very few people in the Hachiko. This is because it's during the Corona time. And here in Japan, my hobbies is it includes running at night because as a PhD student, you are very busy in the morning. So most of the time I would walk or run in a park near my house, and that will be kind of what my I will do to distress a little. I also like reading novels, so like reading English novels. And then I like visiting museum. I am a big fan of impressionist art. So I really like looking at artworks. And I guess same with a lot of Japanese salarymen, I guess. I like drinking. So after a long day of work, it is really fun to drink and I really enjoy socializing and I think among the Japanese here, I guess the drink lemon sour or the strong zero. I really like it a lot. So yeah, more detail about me is that I am born in 1997 and I am born in Manila, which is the capital of the Philippines. So this is me when I was around a year old, so 1 year old, and this is our family camera. So yeah, even at 1997, I'm already doing some selfie. But the weird thing is, I'm not good in taking selfies, so this is probably the only selfie I took my whole life. And then this is me started going to school around 2001. So I am young and I think I still look the same, I guess, just with complete set of teeth, I think. I mean, and then 2014, I started my undergraduate in material science and engineering at the University of the Philippines in Diliman. And this is me during my high school graduation, just before starting the university. And yeah, I think my face is still the same until now. And this is me after 5 years because engineering degrees in the Philippines are 5 years long. So at last, after 5 years, I finished my bachelor's degree in materials engineering. And after I got my bachelor degree, I took some months off after studying a lot. I guess I need a short break. And while taking a short break, that's when I applied to go to grad school in Japan. And I'm quite afraid that I might not get into Tokodai. So when I received a job offer from Huawei Philippines, I worked there, and then just after 2 months of working, I received an email from Tokyo Tech asking me to come to Japan in 2020. So after working for 5 months, I think I quit and went to Japan in 2020. So this is me in Tokyo during the pandemic time. Let's and then after 2 years, I got my master's degree. So this is me during the graduation. And now I'm a PhD student on my second year. So still 2 years to come, hopefully, before I graduate. So as I mentioned earlier, I was from Manila. So I'm born in Manila. But my parents are both from Marinduque, which is a prefecture here. So it's a prefecture 7 hours away from Manila. And it is called the heart of the Philippines. So you can see this is the shape of the Marinduque. So it's not shaped like this heart, but rather like the heart, which is the body part. So like this kind of heart shape, not like this one. So it's also called as the heart of the Philippines because it's the center of the Philippines, like the genetic center. So it is where the kilometer zero is of the Philippines. So yeah, it doesn't look like the center, but yeah, it's a 0 kilometer. And if you look at the Philippines, like a Hachiko who is sitting, like a sitting dog, the heart is placed in this area. So yeah, I think it is safe to consider that it's the heart of the Philippines. It is 7 hours away from Manila, and you have to ride a ship to go there. And it's known for its marine biodiversity because it's covered by ocean, and the Moriones Festival, which is a big festival in my province or in my parents' hometown. So here's Moriones Festival, and it is held annually during the Lenten season. So from March to April. So Lenten is just the because Filipinos are Christian predominantly. So Lenten is like the during the Easter time. So I know for Christian, Lenten season should be a holy season wherein you should be thinking of your sins and asking for forgiveness. But in my parents' hometown, this is a celebration season, very opposite because this is our festival and it depicts the life of a Christian saint, which is Saint Longinus. And then people around the province will wear this mask, which is like a Roman soldier mask. And yeah, and it's during the summertime in the Philippines, so it is very hot to wear this, and they're all lining up and wearing masks. But yeah, I think this mask is very colorful. But when I was a child, I am really scared of this mask because they look like very scary, man. And aside from this festival, yeah, there's some food that are unique to my parents' hometown. So first is this kind of cookies. So it came from the uraro plant, which is probably not found in Japan, but it is a very soft cookie. And we also have rice cake, which is bibingka, but very different from the other cities in the Philippines because the bibingka is a little much more stickier, I think, and not the same as the usual one. And we have this manakla, which is crayfish. So crayfish is like the middle of a lobster and a shrimp. So it's like a in between of the two. And we call it manakla, and it's a crayfish. And aside from food, if you come to the Marinduque, you will have a fun nature trip because it's a rural area with very good nature scenery. So, and the good thing is it's a small island. You can just visit the whole island in just one day. So that's how exciting going to Marinduque is. And it's a lot of greeneries. And we also have a lot of white beaches. So Philippines is known for the white beaches and very fine sand. So one example is Boracay, but Boracay is too crowded. So Marinduque is not so crowded, so you can visit there if you want a peaceful summer or beach vacation. But this one is the most interesting for me. We have this hospitality welcome ritual that I will not describe it anymore. It is a very fun experience, and I recommend going to Marinduque and experiencing this hospitality experience. And a lot of people I know who comes to Marinduque would always think that this is their core memory. Uh, so I will not give any more details about this hospitality ritual. So it's for you to experience. So if you really want to know what this experience is, you have to go to Marinduque. And I guess that's all about me, a little longer. So now we go to the main topic, which is about cancer nanomedicine and the scope of this kind of discipline. So, well, of course, we have to understand what is cancer first. And just to further look at it, we look at statistics first. And it's going to be a little dark, but I think we have to look at those cancer statistics. So first, 1 in 5 people develop cancer in their lifetime. And this is quite unfortunate, and probably maybe one of us one of probably someone, maybe a famous person who have or had cancer. And just to look at it, at 2020 there are more than 19.3 million cases of new cases of cancer in just 2020 alone. So every year there will be more than 19 million new cases. And if you look at this picture, uh, each of this box is made up of 1 million dots. So each of yeah, each dot, if you look at it, if we count this, it will add up to 10 million dots. And that number is the same number of cancer deaths every year. So imagine each dot represent one person that die of cancer every year. And you know, I remember a friend of mine who will tell me that I hate it when we consider people as a statistic, because each person has their own life, has their own story. And that friend of mine told me that I don't want to be just a normal statistic. And I think all of us kind of have that goal, right? I don't want to be just a small part of a big number, and I don't want to be just a dot in this one. So that's how important it is to kind of look into cancer and kind of treat it, because it's very deadly. It affects a lot, and it not just one person but also the people around that person. So cancer is the main enemy for me, and I think the main enemy for most of the people. Well, it's my main enemy because I'm studying it, and it's really difficult to study cancer. And I guess if you watch TV shows like in the Netflix, like Korean drama or Filipino drama, there, when we say cancer, we always say tumor. So if one person have a tumor, we always say like, oh, someone have cancer. And one thing is that they have the benign tumor and malignant tumor. And the question is tumor really synonymous to cancer? So we will look at it in the next slide. So when we say cancer, a scientist like me and a researcher like me will describe cancer using this one, the hallmarks of cancer. So technically, the hallmarks of cancer just describe what cancer is or what makes cancer cancer. But this is mostly what happens in the cellular level. So in each cancer cell, these things happen. And even though I study cancer, I still do not memorize this whole thing. It's very complicated and it's a very complex. But as you can understand in this figure, there are a lot of things that is happening in the cancer cells in the molecular level. And this is how complex the disease is. So doctors and scientists are kind of like describing cancer in a very complex manner. But luckily, there's this one simple explanation that I found. So this explanation is made by the U.S. National Cancer Institute. So they summarize this whole um, molecular level symptoms of cancer, and they define cancer as a disease in which some of the body cells grow uncontrollably and they spread to the other parts of the body. So how do we relate this definition to the words that I mentioned earlier, like tumor, the benign, and malignant? So tumor is technically a tissue or a part of the body that grows abnormally or grows uncontrollably. So we see here that this description is the description of tumor. And then the next one, the spread to other parts of the body, is synonymous to being malignant. So given this, we can consider cancer if we have a malignant tumor. So yeah, given how big cancer is a problem in the medicine world, how do we usually treat cancer? So this first three is probably the most common way. They're called the conventional way to treat cancer. And probably most of you have heard it already. So we have the surgery, the chemotherapy, and the radiotherapy. So these three are the conventional ways of killing cancer. And probably you've heard it already. So surgery is by surgically removing the cancer or the tumor, and chemotherapy is by using drugs, cancer drugs, to kill the cancer cells. And radiotherapy is using radiation to kill the cancer cells. And these are just another other ways: the immunotherapy, stem cell transplant, and hormone therapy to cure cancer. So immunotherapy is kind of increasing the immunity or the action of the immune cells to fight the cancer. And then stem cell transplant is transplanting stem cells to our body to cure the cancer. And then hormone therapy is by putting hormones to our body to cure the cancer. But still, the most common way is this three. But sadly, the current cancer treatment methods that we have a lot of limitations. So, for example, not all types of cancer can be cured by surgery. I mean, if you have a cancer in a very delicate area or in an area that is well inside your body, you cannot remove it by a surgery. And chemotherapy have a lot of side effects. I think most of us know that if a cancer patient is taking cancer drugs, they usually lose their hair, right? And that is an effect of the drugs. So that's a side effect. And sometimes the side effects can make the person or the patient weaker. And then radiotherapy is the same problem with chemotherapy. It's not so efficient and it can cause a lot of side effects. So given this problem, this can lead to lower survival rate for cancer. That makes cancer much more scarier disease. So the goal now of the medical research world is to find a way to fight cancer by improving these conventional methods. And that is where cancer nanomedicine comes into the picture. So cancer nanomedicine and why size matters. So nanomedicine. So probably this is the first time you heard of this word. Well, I only heard of this word when I was in the university. So probably the word medicine you already know, for like medicine is to cure diseases. And what about this prefix, nano? So nano means a unit of measurement. So it's a scale of 10 raised to negative 9 meters. So a very tiny size that, you cannot even view it by your naked eye. It's even smaller than the microscopic. You cannot see nano level in a microscope easily. So nano is from the Greek word that means dwarf. So that's how small it is. And these are just some objects or stuff that are in the nanometer level. So our DNA is in the 2.5 nanometer level, and it is 1,000 times smaller than a bacteria. So you cannot see a bacteria by your naked eye. So make it 1,000 times smaller. That's a 2.5 nanometers. And our strand of hair is 100,000 times bigger than 1 nanometer. And an ant, which is a very small insect, is 1 million times bigger than a nanoparticle. So that's how small nano is. So just to give you a clearer picture, because there's so big number, it's a little difficult to imagine. If we take the Earth as 1 meter, 1 nanometer will be one marble. So imagine the Earth being filled with around 10 raised to 9 marbles. So that's 1 meter. So that's how small a nanometer is. But medicine is very important because I mentioned earlier that what makes cancer cancer is because of some characteristic in the molecular level, so in the cellular level. So if cancer is described based on a cellular level characteristic, then we have to fight cancer in a smaller perspective. So we have to fight a cancer cell which is very small with another small object. And uh that is why nanomedicine is very helpful for cancer. And nanomedicine is the utilization of the unique properties of the nano-sized tools to study, to diagnose, to prevent, and to treat diseases with the goal of improving the quality of life. So, oh wait, sorry, accidentally. So, technically, nanomedicine is the intersection of medicine and nanotechnology. So nanotechnology is studying technology at the nanoscale, where unique phenomena occurs and can lead to novel application. So I believe this is a very important term, unique phenomena. So why do we have to make things smaller? So yeah, we do know that cancer cells are small, so we have to fight them with small things. But what makes small things very special? This is because the property of of a material in the nano size is different from a bulk size. So if you have this big material and you make it smaller and smaller and smaller and smaller into a nano level, its properties will be different. So the way it behaves will be very different. And the way it behaves will lead to a new and unique properties. So for example, a bulk material, will you make it smaller, it will have magnetic properties. It will it will act like a magnet, or it will have optical property, allowing it to be light up. Small objects will light up. It have electrical property, can conduct electricity, and at smaller level, it can have a different, unique physical and chemical properties. And as a material scientist, we try to utilize these unique properties to kill the cancer cells. So now we see some cancer nanomedicine in action to better appreciate what is cancer nanomedicine. So, or how do we apply these unique properties in killing the cancer cells? So, nanomedicine in cancer are used to diagnose and to monitor cancer. So, we can use a nanomaterial, put it inside the body of a person, and it can detect and image the body, and it can help in diagnosing cancer efficiently. And it can also carry drugs to make it much more efficient. It can be a therapeutic agent, so you can make nanomaterials that can kill cancer cell. It is an immunotherapy activator, so it activates the immune cells. And it can also be a cancer diagnostic material, so in combining therapeutic and diagnostic, and it can be a cancer vaccine. So we will look at it further as I give examples later. And these are just the advantages of cancer nanomedicine. So I mentioned earlier that the conventional method do not have a high efficacy or high effectivity. But by using nanomedicine, we can improve the efficacy and decrease the toxicity. Then, as I mentioned, there are a lot of side effects. And this side effect is because some of the areas that do not have cancer are being affected. So healthy cells are being affected. So to improve the drug so that it will only focus on the cancer cell, we can use nanomedicine so there will be no off target. And I mentioned that there are some areas in our body that are difficult to reach by surgery. So by using nanomedicine, we allow them to reach those very tight barriers or very difficult to get cancer cells. and it can enhance the drug release. So rather than releasing the drug one time, it can release the drug a very longer time, allowing for much more efficient treatment. And it can facilitate treatment up to a DNA level because the DNA is 2.5 nanometers. So we can fight a small object by using a small material to kill it. And then it can deliver multiple drugs because our body can lead to drug resistance. So by having multiple drugs, it will be much more efficient, and it can uh integrate a lot of the uh methods and diagnosis of cancer. So here are just different types of materials that we use in fighting cancer nanomedicine. And this is only, I know that this is a very uh, difficult terms, but technically what it means is that we make materials that are very small. So rather than making this big, we make things very small, and then we inject these very small materials into your body, into the patient's body. So here are just some cancer nanomedicine in action. So here's the first one. So this is a drug delivery cancer nanomedicine. So doxorubicin and paclitaxel, yeah, these are very fancy words, but they are actually cancer drugs. So these drugs can kill cancer. So when you take it, they kill the cancer cells. So the cancer drugs are put inside the following nanoparticles, and these nanoparticles deliver specific to the cancer cells and control the drug release. So you inject this to the person, and for example, this person have a lung cancer. So it's a very small nanoparticle will travel into your bloodstream, and they will go specifically into your cells. So because for example, if you just drink the medicine, this one, you know, they will just go and have their effect any parts of the body. But when you have this nanoparticle, you can engineer them in such a way that they will only go to the lungs. So you can make them like a small robot, or you can even call them a small Uber Eats. So it's like Uber Eats. You kind of request that the person to go to the lungs or goes to the cancer cell, and this nanoparticle will be like an Uber Eat driver. He will specifically deliver the cancer drugs into the cancer cell and enter the cancer cell because it's very small, and then kill the cancer cell. So we have smaller side effects and no off target. Next is nanomedicine can also be a therapeutic agent. So here we have this type of nanomaterial, and when we inject it to the body, it can be hyperthermia. So hyperthermia is, as I mentioned earlier, the nanomaterial have a magnetic property. They can have magnetic property. So when we put the nanomaterial, and once they are inside the lungs or inside the cancer cell, you put the patient into big magnets, and these magnets will interact with the nanomaterial that is already inside your body, and this will generate heat, and the heat will kill the cancer cells. And this is same with the photothermal therapy. So this one, rather than magnetic property, you use light. So you put the patient under a light, and then once the light hits the nanoparticle in the cancer cells, the nanoparticle will heat up, and the nanoparticle will kill the cancer cells. And then another one is photodynamic therapy. So you also heat the body with light, but rather than forming heat or raising the temperature, it forms this compound that can kill the cancer cell. So technically, the nanoparticles are acting like drugs. They're acting like therapeutic agent. So they are like small doctors. So they're like dwarf doctors inside the cancer cell, and they will kill the cancer cells after being activated by magnet, by light, or even by change in the pH. So next is specifically now my research. So I will not give into much detail about this one because, yeah, you know about the patent and stuff. But technically, I make nano material made out of hydroxyapatite, and I try to combine the therapeutic, so treating cancer, and diagnosing or monitoring cancer. So I make this compound, this nanocrystal, which I call it nanocrystal, and this nanocrystal can diagnose cancer and can cure cancer at the same time. So what I mean by diagnose is that when I put the material in your body, it will light up and it will tell you if you have a cancer or not and where specific your cancer is. So for example, if it goes into your lungs, it will light up your lungs in a like an optical machine in the hospital, and the doctor can see where specifically your cancer is. And then when you put radiation on my material, it will specifically kill the cancer cell more. So this enhances the radiotherapy and also helps in diagnosing cancer. So here are just some of my preliminary results. So, I think this topic is too dark, but my research will light it up a little because as you can see, compared to radiotherapy, it can enhance the cancer radiotherapy by a factor of 4.5. So 4 times more effective than normal radiotherapy. So imagine if radiotherapy is only effective 20%. So by adding my material into your treatment, it can lead to an increase of 4 times. So it will lead to a efficiency of 80%. So 80% effectivity. So it is 4 times more effective than the normal radiotherapy. So actually, my results are also published in a journal. So you can check it. Just type my name, Martin Quindosa, and then just type cancer, and then you can easily find it. So you can read the whole detail in an article online. So this is just the historical timeline of nanomedicine. And you can see that nanomedicine has been used since 1960s. And we just do not know about it. But nanomedicine is already applied in cancer treatment for a long time. And we just do not know about it that much. But there's still a long way to go. And as you can see, there's still a big thing that we can do to further increase cancer patient survival. So what will be the future of cancer nanomedicine is? So first, there are a lot of research in cancer nanomedicine, but the clinical translation is quite small. So the idea is to increase the translation of this nanomedicine technology into actual application. So second is that we can increase the effectivity of cancer nanomedicine, so improving more efficacy. So I mentioned 80% effective. Maybe we can make cancer treatment 100% effective. So that's another future outlook for cancer nanomedicine. And it can also improve, we can also improve the scale of manufacturing because preparing the nanoparticle is a little tough. So maybe we can study to find a way to make manufacturing it in a large scale much easier. And lastly, exploring the unknown. And cancer, as I mentioned earlier, is made out of very complex mechanism. And we have to fight it, we'll have to fight it in a very complex way. And maybe by using cancer nanomedicine, we can explore the unknown things. So we're going to into the unknown things. And actually, yeah, the future of nanomedicine is still unknown because it still have a very big or broad possibility. And it started 1960s, and even before we cannot even imagine something that as small as a nanometer. So maybe in the coming future, rather than nano level, we will even have smaller level, like a smaller than nano is a pico level. So, but we do not know. So I will have to see in the future. So I guess that's all about my presentation about cancer nanomedicine, and I hope that I was able to enlighten you about nanomedicine. And yeah, feel free to ask questions about cancer nanomedicine, and I'm hoping for a very good discussion with you. Okay, thank you.